Quezon City. He's also the professor of behavioral medicine for 26 years and the head of Department of Psychiatry, Sinclair's Medical Center. And last but not least, he said that he's a survivor of many illnesses. Doctor, thank you very much for coming and you're so kind to share your experience with each other. Okay? Is it okay if you stand up here? My good doctor, is it okay for me to just ask you a few questions? Can you please tell everyone your name and where you come from?
I'm Dr. Renea. Probably you have read me a couple of times in the newspaper, broadsheets, and on television. Probably you have never recalled my name because I lose a lot of pounds. I'm formerly 250 and now I'm only 150 pounds.
Really? Oh, really? Wow. That's a big transformation.
But the reduction is not because of the medicine, but it's because I have a bypass. I have a 6-vessel bypass. I'm the lone survivor in Makati Med, the 6-vessel bypass. And then after that, I got blind and both eyes. I have a diabetic retinopathy. Then I survive again. And then I have a very good friend, Mr. Manikyok, who always guided me on something. And, I'm glad that I'm always with him. And he introduces me a lot of things that I have never seen in the mainstream of medicine. But then again, I'm glad that I'm always listening to him, and he lent me a lot of books which I have never read before. But there are ways that I can discern whether what the book is telling the truth or not. Now, at one point in time, probably because of my job, I always walk and never see my foot. One day, I just saw my second toe. It was diabetic gangrene. And I was so scared. And it's so black. And it's full of pus. And the nail is already getting out, no? So I went to the hospital where I teach, and then I asked my the emergency surgeon doctor said, let's cut the toe, and I said no. I'm telling you, don't cut the toe, just remove the nail, and I'll fix it. No, sir. It is according to our standard of teaching that we cut the toe. Don't cut the toe. You cut the nail. Remove the nail. No, sir. No. No, I said, no, please. Listen to me, my son. You're just only my student before. Remember this, no? So, listen to me. There is no student greater than the master. So, please, remove the toe, remove this, remove the nail, no? And so after removing the nail, I debride it, no? I debride the wound, cleanse the wound every day, and Manny introduces me to buy spray. I put 3 spray and I put spray there. And then it was a miracle, no? And I said, Manny, what is the content of that? He said, I don't know, Dr. Yan, no? But then again, as long as you recover, then you can tell, no? So, and then I took fond of it, and then every time I see some other patients having diabetic gangrene, I always introduce them to this medicine, no? And I tell them that I'm not telling you, and I don't want to give testimony unless you have used it, no? And I never tell my patients what to use and what not to use unless I have used it. So I've used it already. So you have already my proof and safety profile that it is safe because I'm still alive, no? And my foot is still there, no? So I think that's the way only how it goes, no? So I think that's all for this afternoon. Thank you very much.